If you've been told your testosterone level's normal, but you're still dealing with symptoms like low energy or brain fog, low libido, mood issues, don't just accept that answer. Ask what was actually checked. Was it just a total testosterone, or did they actually look at the SHBG and the free testosterone, the LH, the FSH? Because you know your body. You know something feels off, and you deserve more than just a quick glance at one number and you're fine. Or worse, a prescription for an antidepressant or an ED medication without ever looking at the full picture. That's just masking the symptom. And whether you're working with your PCP or using an online service, advocate for yourself. Ask for a comprehensive panel. And if you're not getting the answers you need, find a provider who will dig a little bit deeper. Everything shared on this podcast is for educational and informational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. As a nurse practitioner, my role here is to solely act as an educator, not your personal healthcare provider. Accessing this content does not create a patient-provider relationship between you, me, or Blue Zone Health and Wellness. Always consult with your personal healthcare provider for any medical decisions or before starting any treatments. Let's get to it. Hey guys, welcome back to the Data Driven Health RX podcast. This is Miguel, and today I'm going to be talking about male hormones, specifically around what a normal testosterone level might look like, what it might not look like, what your provider might not be checking as part of the evaluation in a primary care setting, and what a comprehensive hormone panel should look like. And the reason I'm bringing this up today is because I was recently having a conversation with a friend of mine, lives out of state, and he was telling me about some symptoms, low energy, he's been kind of feeling depressed, taking an antidepressant, dealing with some sexual symptoms. And I mentioned, well, have you had your hormones checked? And he told me he did, saw his PCP. PCP already ran some labs and said his testosterone is fine. And I'm sitting here thinking, well, I wonder what they checked, because in a typical primary care setting, they check a total testosterone, and that number might technically fall within the reference range, but that doesn't mean you're optimized. And it doesn't mean that you're getting an accurate picture of what's actually happening in your body. So I don't know exactly what was checked, what wasn't. I didn't look at lab work. He's not my patient, but he's sitting there thinking he doesn't feel fine. Something's not right, but doctor said that labs are normal. So what are you supposed to do with that? Your hormones affect everything. Your energy, your mood, your body composition, your sleep, mental clarity. It's not just the sexual function. So when things are off, you kind of feel it, right? The problem is most men don't get their hormones checked until something's already broken. It's not on their list of things to do. They wait until they're exhausted or depressed or gaining weight or once the relationship is suffering. And by that point, they've been running on empty for a few years probably. So getting a baseline and knowing where your hormones actually are, especially as you're getting into your later years or middle years, it gives you something to work with. It lets you catch things early and helps you make some informed decisions and actually optimize instead of just putting out fires later on down the road. So let's talk about what normal actually means when it comes to lab work, because I think that there's a big misconception here. When labs give you a reference range, that range is based on averages, okay? So it's showing you where most people fall. But average for one doesn't mean optimal. And when it comes to testosterone in particular, those averages, they've been shifting over the years and not in a good direction. Testosterone levels in men have been declining steadily since the 1960s by as much as something like 40%, which is staggering. And as the population's testosterone levels have dropped, so has the lab reference ranges. So when your doctor compares your testosterone to a reference range, they're comparing you to a population that's already compromised. And when your PCP tells you that your testosterone level is normal, just know that normal doesn't mean optimal. It just means you fall somewhere in the average of a population that's been declining for decades. So even if your provider checks your testosterone and it comes back within range, there's still a huge piece of the puzzle that's missing, and that's the SHBG. SHBG is the sex hormone binding globulin, and it's a protein in your blood, and it binds very easily to testosterone. When testosterone is bound to this protein, it can't do anything else. It can't act on the androgen receptor that it's intended to act on. So you're not getting the energy, you're not getting the support in the libido, it's not helping with mood or muscle. It's essentially just being held hostage. So you could actually have a total testosterone of, let's say, 500 or 600, a number that looks perfectly fine on paper, but your SHBG might be sky high. And the majority of that testosterone that you're seeing on that total testosterone number, it's locked up and it's unavailable. So what actually matters is your free testosterone. It's the portion that's not bound to that protein and that can actually get to work in your body. So this is why checking a total testosterone alone doesn't give you a full picture. You need to know how much of that testosterone is actually free and available to do its job. And the only way to know that is by checking the SHBG and calculating or measuring free testosterone directly. Without that information, you're flying blind. You might have a normal testosterone and still be functionally low because so much of it is being held hostage by the SHBG. Now, this isn't just a PCP problem either. The same gaps can show up with these online hormone clinics and at-home test kits. Now, there's a lot of direct-to-consumer options out there right now, and some of them are great, but some of them run comprehensive panels and use venous blood draws through lab partnerships, and some of them don't. Some of them are only checking total testosterone and calling it a day. So if you're going to use one of these services, just make sure you understand what you're actually getting. Are they checking SHBG? Are they checking free testosterone or calculating it for you? LH and FSH, are they checking those? And it's also worth noting that venous blood draws, that's the gold standard. Venous blood draws are when they're actually pulling the blood from your vein. Some of these at-home kits, they use finger prick collection or these little devices that you can put on your arm and it fills a little tube up. That's not venous blood. So this can have limitations as well. It doesn't mean that they're useless, but just something to be aware of, especially if you're considering treatment based on those results. When it comes to getting an accurate and complete picture of your hormones, how the blood is collected actually matters. So what should you actually be looking for when you get your sex hormones checked? First, total testosterone. Yes, we still want that number. It's a starting point, but it's just that. It's just a starting point. We need more. We need the SHBG that I talked about, that protein. I talked about why it matters and how it binds to testosterone. Without that number, without that lab value, you have no idea how much of your testosterone is actually available. And then there's free testosterone. Some labs, they measure this directly. Others, they calculate it using a formula. They use the total testosterone, the SHBG, and albumin to come up with the free testosterone. Either way, this is the testosterone that's actually doing the work in your body. And then there's LH and FSH. Those are also important, and these sometimes get overlooked. These are the hormones in your pituitary gland, and they release the signal to your testicles. They tell them to produce testosterone. And here's why they matter. They help to figure out where the problem's actually coming from. So if your testosterone level is low and your LH and FSH are high, that tells us that your brain is doing its job, right? It's sending the signal. It's telling your testicles to produce more testosterone, but they're just not responding. And that's what we call primary hypogonadism. It means something is going on within the testicle that could be age-related, it could be damage to the testicle, could be something else. But the issue is at the level of the gonads, of the testicle. Now, if your testosterone is low and your FSH and your LH are also low, then that's a different situation. That tells us that the signal from the brain isn't getting through in the first place, that the LH and FSH are not getting pushed to the testicles to produce testosterone. So that's secondary hypogonadism. The problem is more upstream at the level of the pituitary or the hypothalamus. And that can be caused by things like chronic stress, obesity, opioid use, could be head trauma. I talked about TBIs in one of my newsletters. That's where this comes from. Even a pituitary tumor, in some rare cases, that can cause secondary hypogonadism. So knowing the difference matters because it changes how we approach the treatment. If it's a primary issue, we're likely looking at testosterone replacement. If it's a secondary issue, we might be able to address the root cause and then restore your body's own production, or at least understand why it's happening before we actually intervene. And then estradiol is another one. Men need estrogen. It plays a role in bone health, in brain function, in libido, but we want it in balance. If it's too high or if it's too low, it can cause issues. So it's definitely worth tracking. And depending on the situation, we might also look at prolactin or a PSA, which is a prostate-specific antigen, and a few other markers. But at minimum, if someone's not getting the SHBG, the free testosterone, your LH, and your FSH alongside the total T, then you're not getting the full picture of your sex hormones. Now, one thing that I should mention, insurance doesn't always cover these types of labs. And even when it does, the billing can get a little complicated. A comprehensive hormone panel billed through insurance can run about $3,000. And depending on your plan, you could still be on the hook for a significant portion of that. So I offer labs to my patients where they can use their insurance if they want. However, I always recommend calling ahead to confirm what is covered so that there's no surprises later. That said, the cash pay rates for a comprehensive panel, they run a couple $100. So what does this all mean for you? If you've been told your testosterone level is normal, but you're still dealing with symptoms like low energy or brain fog, low libido, mood issues, don't just accept that answer. Ask what was actually checked. Was it just a total testosterone? Or did they actually look at the SHBG and the free testosterone, the LH, the FSH? Because you know your body. You know something feels off, and you deserve more than just a quick glance at one number and you're fine. Or worse, a prescription for an antidepressant or an ED medication without ever looking at the full picture. That's just masking the symptom. And whether you're working with your PCP or using an online service, advocate for yourself. Ask for a comprehensive panel. And if you're not getting the answers you need, find a provider who will dig a little bit deeper. Now I'll say this, the labs we talked about today are also just a starting point. It's not the full picture. I often add in vitamin and micronutrient testing to really put the pieces of the puzzle together, because sometimes symptoms aren't hormone related. And that's why I listen to what my patients tell me first, what they include on their intake form, so that I order what I think needs to be checked based on their individual situation. And you don't always get that with some of the online services. You pay for a package and that's what you get. So that's what I'm here for. Thanks for tuning in, guys. I'll see you on the next one.